Good day. My name is Jeff Brosco. I'm the Director of the Division of Services for Children with Special Healthcare Needs within the Maternal Child Health Bureau in the Health Resources and Services Administration. And it's my great pleasure today to have the opportunity to speak with Miss Cassandra Trimnell. Cassandra is the founder and leader of Sickle Cell 101, a lifelong sickle cell disease warrior and a leader within sickle cell community. She is the first child diagnosed with sickle cell disease in Iowa by newborn screening, and she's widely recognized for her expertise. She's been part of the New England Journal of Medicine's Sickle Cell Gene Therapy Patient and Physician Perspective Series and the NHLBI's Cure Sickle Cell Initiative. Her tireless dedication, her unwavering commitment have solidified her as a respected leader and advocate for all stakeholders in the sickle cell community. She inspires innovation by education, research, awareness, a whole bunch of other great things. Welcome, Cassandra.
Thank you so much for having me here today.
Great. Can you please just tell me a little bit about you and your path to founding and leading Sickle Cell 101? It's such a cool organization.
Sure. I created Sickle Cell 101 over a decade ago because as someone living with sickle cell, I recognized a huge need for easily accessible resources and education to help people better manage the condition. I saw an opportunity to leverage my background and training to provide a desperately needed resource and to do so in a way that resonates with the global sickle cell community. So over, I guess, a decade now, Sickle Cell 101 has the most comprehensive digital platforms, and it's specifically tailored for sickle cell patient education and also generation of real-time community insights, reaching millions of people annually across 130 countries. We harness the power of our digital platforms to connect and engage the global sickle cell community where they are, and in a way that is truly meaningful and resonates with our lived experiences.
So cool, Cassandra. And I imagine that your professional work, in some sense, is related to your personal life with your condition, with sickle cell disease. What contributes to your quality of life? What helps you thrive with sickle cell?
Yeah. So first I'll start off by saying being scared of the unknown and the unpredictability is an underappreciated challenge of living with sickle cell disease. And what brings me a sense of stability is knowledge of what I am living with,
Yeah,
um, and also the tools that I need to best navigate my health conditions. So for me, knowledge translates into action. It's the simple rule of when you know better, you do better. So as part of our efforts with Sickle Cell 101, we partner with physicians, researchers, advocates, and other experts to create evidence-based educational content that enables us to um, reach people and people impacted by sickle cell across the globe to better manage the condition and to ultimately improve their quality of life. That's the goal.
got it. Well, as you're surely aware, it's Sickle Cell Disease Awareness Month. Just wonder if you could share what you see as some of the wins and progress that matter most to you and to other stakeholders.
Of course. I would say a longtime slogan of ours is awareness is the cure. And so every day people are born unknowingly with sickle cell disease and die unnecessarily due to lack of access and adequate care. A major component of these barriers can be attributed to lack of awareness for sickle cell. So in the century that we've known about sickle cell, which is the first described molecular disorder, it is only within the last 30 years, I'd say, that we've had therapies, and only within the last 5 to 10 years that we've received the type of awareness that I would say is more closely proportional to one of the most common genetic disorders worldwide. And, due to research advancements, um, this is the case now. So it's a win. However, there's still so much more to do.
Yeah, and that leads into my last question, which is you did a nice job of sort of recounting some of the history. What are your hopes and vision for individuals living with sickle cell now and in the future?
Sure. So while historically the sickle cell community is disadvantaged and underserved, equity always comes to top of mind for me. I don't necessarily envision a world without sickle cell because I think our community brings an incredible amount of value to the world that we live in ways that wouldn't ever originate unless we existed. So I more so envision a world where a baby's born with sickle cell, and despite their background and circumstances, they have access to options. They have access to being able to manage the condition, allowing them to live a meaningful and fulfilling life. So to me, this is what equity looks like.
So I just want to thank you, Cassandra, for sharing how your personal experience with sickle cell has led to really remarkable professional work that has clearly impacted the community worldwide. We thank you for all of your time and effort and service, and we all hope for the same kinds of goals that you just laid out for us. Thank you very much.
Thank you.
Produced by the U.S. Department of Health and Human Services.